Hi, everybody. Dr. Taylor here today to talk about cholera. My two colleagues and I are here today to break down the basics of cholera, some steps to decrease your chances of contracting cholera, and some global health initiatives that are currently in place to put an end to this crappy disease. Now, on to the basics. Cholera is an acute, severe diarrheal disease that can kill within hours due to dehydration if left untreated. There are approximately 1.3 to 4 million reported cases every single year, resulting in about 21,000 to 143,000 deaths worldwide. The most infected will have no or mild symptoms and can be treated with oral rehydration solution, but severe cases, however, may require intravenous solutions and/or antibiotics. Cholera is most prevalent in Africa, Southeast Asia, and developing countries without access to clean water sources, and it is sometimes referred to as the Blue Death because when someone dies from cholera, the severe dehydration results in their skin turning a grayish-blue color. On to some symptoms that, in regards to cholera, it is extremely virulent, meaning that it has a high capacity to infect a host who ingests infected food or liquid, which is usually water. It causes watery diarrhea, vomiting, and other symptoms can occur within hours, but may also take up to 5 days. Bacteria can remain present in feces for 1 to 10 days, whether it is on the ground or buried in the earth. Onto the epidemiology of cholera. Cholera is most commonly found as an endemic or an epidemic. Endemic areas have confirmed cases within the last 3 years with evidence of local transmission within that area. Outbreaks and epidemics occur in areas of endemic or non-endemic countries, but are found in areas where cholera does not typically occur, and outbreaks are defined as having at least one confirmed case. Now on to the history of cholera. The 19th century, cholera started to emerge globally from its original reservoir in Ganges Delta of India. It was first discovered in the Americas in the 1800s before the use of modern water and sewage treatment systems, which helped eliminate the spread of cholera by lowering the amount of frequency of contaminated water. 6 subsequent pandemics killed millions across all continents, one of which was contained by John Snow, who we all know as the father of epidemiology because of his work identifying the source of cholera outbreak in London 1854. And he also identified cholera as a waterborne illness. A 7th pandemic began in Southeast Asia in 1961, and it reached Africa by 1971, and then landed in the Americas in 1991. Cholera is most commonly now found as an endemic across many countries. Some major risk factors of cholera include inadequate access to clean water and sanitation facilities, traveling or living in developing areas, at-risk areas such as peri-urban slums or refugee camps, and improper burial or handling of infected dead bodies. Another factor impacting increased levels of cholera is failure to record cases due to limitation in surveillance and fear of impact on tourism, which results in more people contracting the disease and spreading it globally. Now, how is cholera spread? Cholera germs are found in the feces of infected people, and it is spread when the feces of those infected people get into the water that people drink or the food that they eat. It is not directly transmitted from one person to another. There has to be food or water involved. What should you do if you suspect that you are infected with cholera or a loved one is infected with cholera? You should take oral rehydration solution if you have it readily available. If not, you should go immediately to the hospital and you can receive that solution or an intravenous solution if that is necessary.
Hi, I'm Dr. Plew, and I'm here with the World Health Organization to discuss the current policies that are in place to end the spread of cholera across the world. The first system that's been put in place was the Safe Water System. It was established in 1990 and provided 2 billion people with access to improved drinking water sources and 1.8 billion people access to improved sanitation. With this in place, however, there are still 780 million people worldwide that do not have access to improved water sources and 2.5 billion people who lack access to adequate water sanitation. 88% of deaths due to diarrheal diseases worldwide are attributable to unsafe water. These diarrheal diseases, such as cholera, kill more children than AIDS, malaria, and measles combined, and are the second leading cause of death among children under the age of 5 worldwide. The second program that's in place are mobile health interventions. Smartphones are being used to improve clinical guidelines and the adherence to them and provide a format for reporting clinical and laboratory endpoints in real time. This technology has been implemented in government district and sub-district hospitals in northern Bangladesh, which is an area that is at high risk of cholera outbreak. The results of the smartphone program were an increase in antibiotic program adherence, zinc supplementation adherence increased, and IV fluid program adherence increased. In the sub-district hospital, the adherence rate to antibiotics went from 13% to 82%. And in the government district hospital, it went from 63% to 99%. Upon the 10-day follow-up of this program, there were no adverse events related to it. Cholera vaccinations. There are two types of cholera vaccine that need to be administered in 2 doses between 1 and 6 weeks of each other, and one type of vaccine that can be administered in a single dose. Dukoral is a vaccination that provides protection against cholera for 2 years, and it can be given to anyone above the age of 2. Chanchal and Uvecol must be administered in 2 doses with at least 2 weeks between them and provides protection for up to 3 years. The FDA has recently approved a single-dose live oral cholera vaccine called Vaxchora. The third program that is present worldwide to eliminate cholera spread is the Global Task Force on Cholera Control, Ending Cholera, a Roadmap to 2030. This program was launched in 2017 in an attempt to reduce cholera deaths by 90% and to eliminate cholera in as many as 20 countries by 2030 through the following methods. Supporting the design and implementation of global strategies to contribute capacity development for cholera prevention and control. Providing a forum for technical exchange, coordination, and cooperation on cholera-related activities to strengthen countries' capacity to prevent and control cholera, especially those related to implementation of proven effective strategies and monitoring of processes, dissemination and implementation of technical guidelines and operational manuals. Supporting the development of a research agenda with emphasis on evaluating innovative approaches to cholera prevention and control in affected countries, and through increasing the visibility of cholera as an important global public health problem through integration and dissemination of information about cholera prevention and control, and conducting advocacy and resource mobilization activities to support cholera prevention and control at a national, regional, and global level.
Hi, I'm Dr. Dimitrakakis, and I'm going to go over the 5 basic steps for preventing cholera. Step 1. Drinking and using safe water. Bottled water and canned beverages are safe to drink and use. Use safe water to brush teeth and wash and prepare food and to make ice. In order to be sure that water is safe to drink or use, you should be using, when cooking, be sure to boil for at least 1 minute. If using to bathe or clean oneself, water should be treated with a chlorine product or treated with bleach. Step 2. Washing hands often with soap and water before eating or feeding, after using the toilet, after cleaning a child's bottom, or after being in a room where diarrhea was present. Step 3. Use latrines or bury your feces. Do not defecate in any body of water. Use latrines or other sanitation systems like toilets to dispose of feces. Wash hands after disposing of feces. Clean household toilets with bleach, 1 part bleach to 9 parts of water. What if you don't have a toilet? Defecate at least 30 meters from any body of water and then bury your feces. Dispose of plastic bags containing feces in latrines or collection points. Step 4. Cook food well, especially seafood. Keep it covered, eat it hot, and peel all fruits and vegetables. Boil it, cook it, peel it, or leave it. Be sure to cook all shellfish until they are hot all the way through. And finally, step 5. Clean up safely in the kitchen and in places where the family bathes and washes clothes. Wash yourself, your children, diapers, and clothes 30 meters away from drinking water sources.